Understanding Bipolar Disorder, a comprehensive guide to symptoms, types, and treatment. Bipolar disorder is far more than a simple case of moodiness. It's a complex and chronic mental health condition that affects millions worldwide, characterized by intense, dramatic shifts in mood, energy, and activity levels. These shifts, known as mood episodes, can range from exhilarating highs, mania or hypomania, to devastating lows, depression. While often misunderstood, understanding the nuances of bipolar disorder is the first step toward effective management and living a fulfilling life. This guide will walk you through everything you need to know, from the different types and their symptoms to the most effective treatment strategies and support systems. What exactly is a mood episode? At the heart of bipolar disorder are mood episodes, which are distinct periods of intense emotion that differ significantly from a person's usual self. These are not fleeting feelings, but sustained states that can last for days, weeks, or even months. Mania, a state of intense, elevated, or irritable mood, with abnormally high energy. It significantly impairs daily functioning and can involve psychosis, delusions, or hallucinations. Hypomania, a less severe form of mania. The mood is elevated and energy is high, but it doesn't typically lead to major functional impairment or psychosis. It's noticeable to others but might feel productive to the individual. Depression, a period of profound sadness, hopelessness, and a loss of interest in most activities. It's accompanied by low energy and can be debilitating. The spectrum of bipolar disorder, types and variations. Bipolar disorder isn't a one-size-fits-all diagnosis. It exists on a spectrum, with several distinct types defined by the pattern and severity of mood episodes. Bipolar. I disorder, bipolar I, is defined by the presence of at least one manic episode. This manic episode may be preceded or followed by hypomanic or major depressive episodes. For many, the depressive episodes can be particularly severe and long-lasting. The defining feature of bipolar I is the severity of the mania, which often requires hospitalization to ensure safety and stability. Bipolar II disorder. Bipolar II is characterized by a pattern of at least one major depressive episode and at least one hypomanic episode. Crucially, individuals with bipolar II have never experienced a full manic episode. Because hypomania can feel good and even enhance productivity, people with bipolar II often seek help only during their depressive episodes, which can sometimes lead to a misdiagnosis of major depression. Cyclothymic disorder, cyclothymia. Cyclothymia is a milder, yet more chronic form of bipolar disorder. It involves at least 2 years, 1 year in children and adolescents, of numerous periods with hypomanic symptoms and periods with depressive symptoms that do not meet the full criteria for a hypomanic or major depressive episode. The ups and downs are less severe, but are persistent, and can significantly impact relationships and daily life. Recognizing the symptoms. The two faces of bipolar disorder. Understanding. The specific symptoms of each mood state is crucial for recognition and early intervention. These symptoms go far beyond feeling happy or sad. Symptoms of manic and hypomanic episodes, the highs. During a manic or hypomanic phase, a person may experience 3 or more of these symptoms: abnormally upbeat, jumpy, or wired mood, increased activity, energy, or agitation, exaggerated sense of well-being and self-confidence, euphoria, decreased need for sleep, e.g., I'm feeling rested after only a few hours, unusual talkativeness or pressure to keep talking, racing thoughts, flight of ideas, distractibility, poor decision-making, such as engaging in spending sprees, risky sexual encounters, or foolish business investments. The key difference: mania severely impacts work, school, and social activities and may include psychosis, while hypomania is a shorter, less severe version without psychotic features. Symptoms of major depressive episodes, the lows. A major depressive episode includes 5 or more of these symptoms, which cause significant distress or impairment. Depressed mood, such as feeling sad, empty, hopeless, or tearful. In children and teens, this can appear as irritability. Marked loss of interest or pleasure in all or almost all activities. Significant weight loss when not dieting, weight gain, or increase in appetite. Insomnia or sleeping too much. Restlessness or slowed down behavior, observable by others. Fatigue or loss of energy. Feelings of worthlessness or excessive or inappropriate guilt. Diminished ability to think, concentrate, or make decisions. recurrent thoughts of death, suicidal ideation, or a suicide attempt. Important. If you or someone you know is having suicidal thoughts, please seek help immediately. Contact a crisis hotline, such as the National Suicide Prevention Lifeline at 988, or go to the nearest emergency room. What causes bipolar disorder? Unraveling the mystery. The exact cause of bipolar disorder is unknown, but research points to a combination of interconnected factors. Genetic factors. Bipolar disorder often runs in families. People with a first-degree relative, such as a parent or sibling, with the condition have a significantly higher risk of developing it themselves. However, genes are not the full story. Most people with a family history do not develop the illness. Brain structure and chemistry. Brain imaging studies show subtle differences in the size or activation of certain brain structures in people with bipolar disorder. Imbalances in naturally occurring brain chemicals called neurotransmitters, like norepinephrine, serotonin, and dopamine, are also believed to play a key role. Environmental triggers. Genetics and biology may create a vulnerability, but environmental factors often act as triggers. Periods of high stress, traumatic events, physical illness, or substance abuse can trigger an initial mood episode in a predisposed person. The path to diagnosis and treatment. Getting an accurate diagnosis is the first and most critical step. A healthcare provider will typically conduct a physical exam, a psychological evaluation, and may ask you to keep a mood diary to track your daily emotions, sleep patterns, and behaviors. Comprehensive treatment strategies. Bipolar disorder is a lifelong illness, but it can be managed effectively with a combination of strategies. Treatment is most successful when it's continuous and tailored to the individual. Medication. This is the cornerstone of treatment. Medications known as mood stabilizers, like lithium or valproic acid, are used to control manic or hypomanic episodes. Atypical antipsychotics may be used for mania and depression, while antidepressants are sometimes prescribed for depressive episodes, though they must be used cautiously with a mood stabilizer to avoid triggering mania. Psychotherapy, talk therapy. Therapy is vital for managing the condition alongside medication. Techniques like cognitive behavioral therapy, CBT, help identify and change unhealthy negative beliefs and behaviors. Interpersonal and social rhythm therapy, IPSRT, focuses on stabilizing daily rhythms, such as sleeping, waking, and eating, as routines are crucial for mood stability. Lifestyle management. Healthy habits provide a strong foundation for treatment. This includes maintaining a regular sleep schedule, eating a balanced diet, engaging in regular physical activity, managing stress through techniques like mindfulness and yoga, and avoiding alcohol and recreational drugs, which can trigger episodes. Supporting a loved one with bipolar disorder. Supporting someone with bipolar disorder can be challenging, but your help can make a huge difference. Here are some ways to help. Educate yourself. Learn as much as you can about the disorder to understand what they are experiencing. Encourage treatment. Gently encourage them to stick with their treatment plan, including taking medications and attending therapy. Be patient and listen. Offer a non-judgmental ear. Let them know you're there for them. Help track symptoms. Offer to help them recognize the early warning signs of an approaching manic or depressive episode. Take care of yourself. Supporting a loved one is demanding. Ensure you have your own support system, whether it's friends, family, or a support group for caregivers. Conclusion: living a full life with bipolar disorder. A diagnosis of bipolar disorder can feel overwhelming, but it's important to remember that it is a treatable medical condition. With the right combination of medication, therapy, and lifestyle adjustments, people with bipolar disorder can manage their symptoms and lead stable, productive, and joyful lives. The journey requires commitment and resilience, but recovery and long-term wellness are absolutely possible. If you suspect you or a loved one might have bipolar disorder, the most courageous step is to reach out to a healthcare professional. Help is available and hope is always on the horizon. Subscribe.